Good morning, everybody. This is our COVID meeting for Monday, the 31st of August. I hope everyone had a great weekend. I know it certainly was a wet weekend and some excitement that happened Sunday with a weather-related power outage. I'll be talking more about that at Tuesday Talk, so I hope you turn in for that tomorrow. We're going to go ahead and get started today by going to the COVID board and take a look. This is a week-over-week comparison of the three critical trend lines that we track. The new cases have continued to decline, and they are down 2 consecutive weeks. The test per 1,000 people, it's about 1.2 positivity rate, and that also is trending down week over week. And the third chart is the percent of daily positives. It's about 12.3%, and that is a little higher than the goal and the national average. National average is running about 10 point, and you can see the dotted line is the goal or the baseline that we're looking to achieve. You can see that this is running high for the last 2 weeks, and if you were to go back and look at this, it's been high for probably 7, 8, 9 weeks now. All right, so this is the State of Florida dashboard. Now remember, this runs about 7 days behind. It's a weekly total. You can see that they take it the first of every week. So today's totals will not be released until tomorrow. But the three things we're continuing to track, you can see here in Pinellas County, the light blue indicating that we still are from a county perspective, we're not considered a hot spot. And then coming over to the two charts on the right, the yellow chart is cases, new cases per day, continuing a steady decline. And then resident deaths in the white, you can see that that is significantly dropped off. This is the testing and data sheet for positive test and total test. You can see right here in the center, we are well below benchmark at this time. That line is continuing to drop. We are getting close to 5.5% was the testing, most recent testing, and this is historical testing of about 13%. Again, you can see improvement, downward trend, looking better on a day-by-day basis. So that sort of takes a look at our trends, and we see what's happening across the state of Florida and the United States. Let's dig into the specific numbers. Here in Florida, we had 621,586 cases reported through today. That was up pretty significantly over the weekend. I don't know what happens on the weekend. We've been running 2,500 to 3,000 increase on a daily basis. And this Saturday and Sunday, we topped 5,000 per day. And so I can only assume that we must be having testing data that they are not updating on Saturday and Sunday, and then they dump it into the Monday results, because we were up almost 11,000 since Friday. The fatality rate in the state of Florida did not significantly change. It was just a couple of hundred additional fatalities throughout the entire state. In Pinellas County, our numbers looked much better. We were up 19,742, which is an increase of just about 60 residents in all of Pinellas County. And our fatalities jumped from 641 to 650. So really, as we saw in the chart, the death rate is vastly improved, and the numbers are coming down. Also in Pasco County, they had 172 deaths as of Friday, and over the weekend they only had 2 additional deaths. And so The two counties that we track, because they are connected with a physical connection, the counties, Pasco County and Pinellas County, continue to decline and look much improved. So we will continue to look at that as we think about next steps and the plan to roll into a different stage and ultimately into phase 3. Here in the United States, we are on day 86 of phase 2, and there are 5,997,000 cases throughout the United States. Our testing has improved as well. We're up to 193,000 people have been tested in Pinellas County. Pinellas County has a little over 1 million people, so we are almost at the 20% of the population who have been tested for COVID. Our infection rate here in Pinellas County is running about 10.25%. We're just a couple of tenths of a percentage point less than the state average, but it is trending downward, and we've seen that trend over the course of the last week. So good news with that as well. Our hospitalization rate, there have been 2,035 hospitalizations in Pinellas County since the advent of COVID. And in our specific zip, there have only been 368 cases. The primary COVID hospital here in Pinellas County for us is Meese Countryside, and they are reporting about a 30% occupancy on their COVID wing, which means we have not overwhelmed the medical resources necessary to combat and overcome the virus. So those numbers are looking good. I want to roll into what's specifically happening here at Regency Oaks. Our IL resident count is 17 residents who are under quarantine. The majority of those are related to hospitalization and people who have just recently moved in. And some of those are on loose quarantines and some are on strict. In our skilled nursing, we have 9 residents that are on quarantine. It brings our total to 26 residents under quarantine. That's an increase of 1 since last Friday. In terms of our staff members, we had 2 staff members under quarantine last Friday, and we still have 2 residents or 2 staff members. Both of them are in the skilled nursing, and we're waiting for test results or for them to come off of quarantine. In terms of our COVID-like or flu-like symptoms, we've seen improvement in the IL. There are no residents that we are tracking for symptoms. In the skilled nursing, there are 31 and 24. Those numbers are high because we did a full COVID testing across the licensed campus on Thursday, and we're expecting those results back today. Number of employees that have symptoms, and we are tracking. In the IL, it's none. In the skilled nursing, it's 105, and in the assisted living, it's 15. And again, the reason that we're tracking 125 associates in the health center is because we did a mandatory bi-weekly testing of all staff, and we do that every other Thursday. You might find it interesting to know that some of the key leadership staff here in the IL, who goes back and forth between the assisted living, skilled nursing, and independent living, we also go through the weekly testing. And about the only thing I would share is that's not a fun test. Try to avoid it if you have the opportunity. In terms of confirmed COVID cases, we've had 8 residents who have tested positive since the start of this way back in March, and we've had 17 associates who have tested positive. All right, so that concludes our look at the numbers, and I have a special guest with me here this morning, the president of our Regency Oaks resident organization, Don Infante, and we're going to open it up for a couple of questions that Don has heard that residents are anxious to get a question answered. Don?
Thank you, Brent. We're doing well in the numbers. We're meeting or exceeding goals on all numbers except for one. That means that we should be loosening up a little bit on some of the restrictions that we have. And so the residents I speak with are curious as to what we can expect and when is it going to happen.
So, great question, and let me just sort of give you a little bit of a background to tell you where we are and how I see us moving forward. So, you'll remember that the Reopening America plan is 3 phases, phase 1, 2, and 3, and within each of those phases are stages. There were 10 stages in phase 1, 12 stages in phase 2, and 10 stages in phase 3. So we are in stage 8, phase 2, which means we're about halfway through the process of reopening our community. There are 2 things that are impacting our ability to move forward. And the first is the number of new cases that are being seen in the state of Florida. And they call this the case pop. And there is a benchmark that's been set by the governor after consulting with CDC and the Center for Medicare and Medicaid Studies. And that benchmark is the number of new cases per 100,000 residents. And we are currently, for the state of Florida, sitting at about 8 per 100,000. That's above benchmark, and we're not able to take the next steps until we've seen improvement in those numbers. So that's the first thing we're waiting for. We've got to get those daily cases, new cases, down from that weekend high of 5,000 down to where it's about 2,000 residents consistently day in and day out. The second thing that we're waiting for is to see what happens as a result of reopening our dining room. Now, I am very pleased with how that is going. Residents, you have been so supportive and cooperative. Everybody has been practicing great social distancing and wearing masks. We're getting nearly 50 people in either dining room at night. So about a quarter of our population has returned to eating in the dining room. In order to advance to the next stage in phase 2, we've got to be able to successfully do that for about 14 days. And you say, why 14 days? If we go back to what we know about COVID and how it is spread, if we had reopened the dining room and created a higher exposure for residents, we know that in the first 5 days, you go from exposure to first symptom, and from day 5 through about day 11, you are virtually shedding, which means you are passing on the disease, and then from day up through 11 through 14, you will still test positive, but will no longer be contagious. So what we're looking for is to get beyond that day 5, 7, and move into a day 11 through 14 without any additional new cases here at Regency Oaks. That's why it's so important when we talk about the counts, the number of people we are tracking who are symptomatic, that Regency Oaks in the IL has no residents that we're tracking other than hospitalization and new move-ins. If that trend continues through the rest of this week, we'll be able to take some additional relief and start making some other restrictions, removing other restrictions for the residents.
Brad, the only other input I've had from residents has to do with maintenance request. I know we're in a special maintenance period. We have some processes, but some of our residents do have emergencies, and I've been speaking with some of them, and they're wanting to be reminded, as if they do have an emergency, what should they do, and what kind of reaction should they receive?
Okay, great question, and I'm going to start with talking about how some of our services have been restored in dining and in activities, and those services tend to be group services. We're currently allowing up to 50 individuals in an interior setting with appropriate distancing and mask. What, Don, you are referring to is what is called a single service. And why that is different, it's something like transportation, where one person is in one car. It is a housekeeping service where one person is in one apartment. It is a maintenance service where one person is in one apartment. And these single service in confined areas, whether it's a car or an apartment, are currently prohibited in the stage and phase where we are. Now, there has been some lessening, but you probably are not aware of it. We originally had restricted our maintenance to what we call emergencies: plumbing, electric, HVAC, air conditioning. We're now including critical maintenance work orders. So if you have an appliance that goes down, we'll be able to assist you. If you have a suspicious noise in an air handler, we'll be able to assist you. What we're not yet able to do is what is called routine maintenance. And those are the just day-to-day annoyances that do not impact or threaten your ability to live in your apartment. Those are still restricted and will not be returning until phase 3. Here's my recommendation. It's funny as you think about this. You might think that a light bulb would be a non-essential service, but in fact that's considered a critical service, because if you don't have a light in your apartment, you're at risk of falling. So when in doubt, it doesn't hurt to call the front desk and say, hey, I want to put a work order in. If they're not able to do it, you'll hear back, and it puts you first on the list once we are able to release individual in-apartment services with our maintenance team. Okay, well, thank you, Don, very much for joining us, and I hope you found today's information useful. I'm looking forward to seeing everyone at Tuesday Talk tomorrow, and until then, have a great afternoon, and we'll see you at Tuesday Talk.